Thank you, Madam Senator. I appreciate you taking the time out to meet with me today.
Well, certainly, Heidi. I have all the time that's needed for any constituents.
Okay. Did you receive the brief I emailed to you today?
Yes, I did, and I just glanced over it slightly, but I had an intern brief me on it with in depth.
Okay. And do you understand what we're talking about when we're talking about staffing for acuity for nurses rather than staffing for the number of patients?
Yes, I do. Having the medical background that I have, I've many times noticed a few nurses a lot more busy and staying more active than a few others that have a lot more spare time. And generally, I have found that it's been the nurses that are better trained.
Okay. So when I'm talking about staffing for acuity, one of the main things with that is taking the patients and looking at the patients as a group instead of saying, okay, I have 6 patients, I need 2 nurses for that. It's saying I have 6 patients. Now we're going to look at what their diagnosis is, what medications they're on, what kind of teaching do they need, especially if they're getting ready to go home. There's a little bit more involved with that so that nurses are able to allocate their time a little bit better to the specific needs of the patient rather than saying, I have 6 patients, I got to get this done, where this other nurse has 6 patients, but her assignment's a little bit easier. So one of the main reasons that I'm bringing this to your attention is there's studies out there that have shown that the overall outcomes of patients are decreased when we do not use the staffing based upon acuity, and we just surely go, we have X number of nurses and X number of patients. Now we're going to equally divide them amongst the mix. So, in fact, one study showed that there's a 7% increase in the overall mortality rates for every time you add an additional patient to a nurse. So that is fairly concerning there. And they also showed that the length of stays tend to increase as you add additional patients to the nurses. But not only are our patients affected, but so are our nurses. Nurses, since you are starting to show signs of burnt out from being overworked by having these really heavy assignments and while not getting equal assignments. So we've seen the decrease in the satisfaction. And we all know once you start having people that are less satisfied, you're going to have an issue with having retention rates dropping and all that. And studies have shown that it costs approximately $80,000 to train each new nurse between recruiting and hiring. Yes, ma'am. It's fairly expensive. And I was hoping that we would have your support, the nurses, to help drive staffing for acuity.
I'd be happy to help.
I appreciate it, and really, I'm going to leave my brief with you. I have my contact information on here. If you have further questions, I would love to speak with you more at length about this.
Certainly, and you'll be hearing from me.
All right, thank you so much. I really appreciate it.